Hi, this is Dr. Tadi. Today I am going to speak about motion sickness. The word motion sickness was first introduced by Hippocrates. It presents with nausea, vomiting, dizziness. The main reasons for motion sickness, one is central, that comes from the brain, one is peripheral, that comes from the ears. So sometimes patients with basilar artery occlusion, if there is a blockage in the back of the brain, these patients come with dizziness and nausea, vomiting. So that is central cause of motion sickness. The percentage of the central causes are much lesser than the peripheral causes, mainly benign positional paroxysmal vertigo, or Meniere's disease, vestibular neuritis. These are all related to the diseases of the inner ear. What is the pathophysiology of the motion sickness? Is there is a excessive firing of the efferent nerves within the inner ear, or as I mentioned before, it could be also secondary to basilar artery occlusion, leading to stroke in the brainstem, like medulla oblongata, pons, and midbrain. So when we are evaluating a patient with motion sickness, always we have to look for the red flags, means patients with dizziness, diplopia, double vision, difficulty in speaking, difficulty in swallowing, drop attacks, we call dangerous Ds. So then you have to rule out basilar artery occlusion for sure. Once that is ruled out, when there is no symptomatology, then we have to start worrying about the peripheral causes of motion sickness, which is much more common, as we see in our everyday experience, that a lot of people comes with motion sickness, dizziness. So a majority of patients fall under peripheral reasons for motion sickness. So how do we treat this? So always head positioning, there are some preventative methods. Prevention is better than cure. So exposing to this particular situations, like going to or playing video games for 10 hours or 12 hours, or traveling in a lot of bumpy road where some people are very sensitive. So basically we have to identify the triggers. What is triggering this motion sickness? Once you identify it, then you can easily prevent those situations. The second thing is then medications, but I recommend try to habituation is one other thing. People who go to moon or this aerospace programs, they all go through motion sickness, but they don't take any medications because they go through this habituation process where they control the motion sickness. Eventually it gets better. So I recommend this approach, non-pharmacological approach. But if people are having this severe motion sickness, there are some medications that can help. One of those medications most commonly used are antihistamines. So meclizine, this is the first generation antihistamine that is commonly used for the motion sickness and BPPV, benign paroxysmal positional vertigo. So these conditions, but the drawback is these are all medications give sedation. That is one issue with the medications. So the other medications are anticholinergics, scopolamine. You can put a patch, a scopolamine patch. So these are some starting medications. So the motion sickness evaluation, you have to identify the red flags and rule out the central causes, and then you have to look for the peripheral causes. Thank you so much.